Hello from sunny Perth, Western Australia. I'm James Hill, Chief Operating Officer at Singular Health Group Limited, and in this short presentation, I'd like to take the next 5 minutes to share with you a bit of the history around Singular Health, what our vision is, what our solutions are, and where we see ourselves working in the Korean market. Our vision since inception in 2017 has been to develop better health literacy, which enables people to access, understand, and use information to make informed decisions about their health. So the problem that we've identified is that since the 1970s, when the CT and MRI or CT scanner was first invented, images have been acquired in 2D planes, as we see here on the left. Radiologists, surgeons, and medical practitioners rely upon these two-dimensional images to diagnose and plan their surgeries, which leads to sometimes inaccurate and untimely diagnoses. What we have developed since 2017 is a volumetric rendering platform that enables the rapid volume rendering of these two-dimensional scans taken from existing CT and MRI machines into a complete immersive 3D model. In this 3D model, it is easy to see the tumour that is located in the pelvic region of this patient in the 3D planes, and then make that diagnosis in a much faster period of time and communicate that better with the patient and other medical practitioners. So applying this to the South Korean market, from a 2015 study, we've found that more than 1 in 2 cancer cases in South Korea have been misdiagnosed, with 61.7% on average having been misdiagnosed, and the vast majority coming from lung cancer. This is very difficult to visualize in those 2D planes, and our 3D volumetric rendering allows for easier visualization, diagnosis, and for the communication and surgical planning with the patients. So the solution was developed from 2017. It's taken us 4 years to develop a platform that works both offline and online, and renders patient-specific anatomy from CT, MRI, and PET scans in only just 60 seconds. This works both in virtual reality, on desktop, and we're soon working on being able to deploy it to tablet and mobile devices so that you're always connected with your own patient cases. We've also been able to deploy this volumetric rendering platform to 4 key verticals, these being complex surgical cases for MedVR, patient education and general medical practitioners with 3DICOM surgical, virtual anatomy for tertiary and secondary education, providing 3D realistic anatomical models combined with patient-specific cases and pathologies for improved medical education, and GeoVR, which takes our volumetric rendering platform and applies it to the geological and mining sectors. We've got a well-established team here at Singular Health, with Thomas Hanley, our Chief Executive, myself, the Chief Operating Officer, and Thomas Morrill with significant experience, and then Professor Guan Tay and Denning Chong providing vast experience in Southeast Asia and academic sectors. So our vision moving forward is for what we call scan to surgery. This is taking scans from existing CT and MRI machines, retrieving them from picture archiving and communication systems, whether locally stored or on the cloud, and then conducting a 3D or VR scan review. Working with our national science agency, CSIRO, we've already developed an artificial intelligence model for doing spinal segmentation, allowing for the rapid segmentation of the vertebrae from patient-specific spines, which allows for 3D printing and for surgical planning. We are currently in the process of integrating a virtual surgical planning application into our software, allowing for the design of bespoke implants, cutting guides and surgical guides, which can be 3D printed either in-country or outsourced and delivered to the surgery. Thank you very much for your attention and for our participation in the BioKorea delegation. Should you have any details or wish to have a further demonstration, please contact us using the details here.